Physiotherapy, MPT first year. So today I will be presenting seminar on physiotherapy management in peripheral nerve injury. So as we all know that peripheral nerve injury, peripheral nerves are the nerves that connect the brain and spinal cord to the muscles, skin and organs. So when these nerves get damaged, it leads to motor, sensory and autonomic dysfunction. So physiotherapy plays an important role in maximizing functional recovery and preventing secondary complications which are occurring because of the damage to the peripheral nerves. Okay, so before going in depth with the peripheral nerve injury, we will look into the anatomy of the peripheral nerve. So we all know that peripheral nerve consists of axon, myelin sheath and all the layers which are covering the nerve, that is epineurium, perineurium and endoneurium. So epineurium is the, as you can see here, so epineurium is the outer protective covering of the nerve, perineurium encloses each nerve fascicles and endoneurium surrounds the individual axon. And myelin sheath helps in increasing the conduction velocity of the nerve, and axon carries and conducts the nerve impulses. And the peripheral nerve has functions such as motor, sensory and autonomic. Motor function, that is muscle contraction. Sensory function, that is pain, touch and perception. Autonomic function, that is vasomotor control and pseudomotor control. Can anybody tell me what is vasomotor control and pseudomotor control? Vasomotor control and pseudomotor control are the functions of autonomic system. Can anybody tell me what is vasomotor control and pseudomotor control? So whenever there is injury to the peripheral nerve, the vasomotor control and the ability of the vasomotor control and the pseudomotor control is damaged. So can anybody tell me what is vasomotor and pseudomotor control? So vasomotor control is ability to control the blood vessels, that is to maintain the skin temperature or vasoconstriction and vasodilation. So whenever the peripheral nerves gets injured, there will be skin color changes, that is the skin can become red, pale or bluish discoloration. For example, if I want to give, the palms may be cold after the median nerve injury because the autonomic fibers which are carried through the peripheral nerve gets damaged, because there is lack of vasomotor control, because of which there is autonomic dysfunction. What is pseudomotor control then? Yeah, so ability to control the sweat glands. So the autonomic fibers which are carried through the peripheral nerve, when these autonomic fibers are damaged, the ability of the nerves to secrete, there is something called as eccrine sweat gland. Okay, so ability to secrete the sweat is reduced here because of the damage to the autonomic fibers which are carried through that peripheral nerve. Okay. For example, the palms may be dry because of the damage to the ulnar nerve. Okay, and the blood supply to the peripheral nerve is called as vasonervular. Okay. Next comes what causes the peripheral nerve injury. So there are many causes which can cause which can lead to peripheral nerve injury, such as it can be caused due to traumatic, compression, stretch injuries, iatrogenic causes, metabolic or inflammatory causes. Traumatic causes include fractures, lacerations or dislocations. Fractures as in if there is any fracture of shaft of the humerus. If there is fracture of shaft of the humerus, the sharp bony ends of the fracture can cause compression of the radial nerve. So there can be radial nerve injury. Lacerations, that is direct cutting of the nerves. Dislocations, for example, the anterior dislocation of the shoulder can cause excessive or overstretching of the axillary nerve. So it can cause damage to the axillary nerve. Okay, so these all include traumatic causes. Compression causes includes because of the repeated overactivity, there is compression of the median nerve in the carpal tunnel, which can lead to carpal tunnel syndrome. Okay, so stretch injuries includes traction injuries during accidents, that is sudden stretch of the shoulder can cause damage to the brachial plexus. Okay, so next comes iatrogenic causes. Iatrogenic causes includes damage to the peripheral nerve during any surgical procedures or intramuscular injections. That is, if the intramuscular injection is given in the wrong quadrant, for example, if I want to give, if the wrong quadrant injection in the gluteal region can cause damage to the sciatic nerve. So this can lead to sciatic nerve injury. Next comes metabolic and inflammatory causes. Because of the imbalance in the metabolic system, it can lead to nerve ischemia, which in turn leads to demyelinating of the peripheral nerves. Okay, infectious causes such as leprosy. Leprosy is one of the examples for damage to the peripheral nerve because it includes the peripheral nerve. Okay, so classification of nerve injuries. So there are mainly three types of classification of nerve injuries according to SEDON, that is neuropraxia, axonotmosis and neurotomesis. So first one is neuropraxia. In neuropraxia there is temporary conduction block, but the surrounding connective tissue is intact. Okay, so surrounding connective tissue in the sense the axon and endoneurium are intact, and there is no Wallerian degeneration occurring, because when Wallerian degeneration happens, if the axon is disrupted, right? So because of which the axon and endoneurium are intact, because of which there is no Wallerian degeneration, and complete recovery is expected here within days to weeks. Okay, for example, if I want to give crutch palsy, Saturday night palsy, or cross leg sitting, that can cause palsy. Crutch palsy, that is incorrect use of the crutch, can cause damage to the which nerve? Axillary nerve. Incorrect use of the crutch can cause damage to the radial nerve and can lead to wrist drop temporarily. Okay, so Saturday night palsy, if a person falls asleep with the hand in an abducted position for a prolonged period on chair or bed, it can cause damage to the radial nerve and also can lead to wrist drop. Okay, so prolonged cross leg sitting can cause damage to the peroneal nerve. The complete recovery is expected here because there is only compression, as you can see here. So there is only compression. The axon and endoneurium are intact here. Okay, in neuropraxia. The second grade is axonotmosis. That is, there is demyelination plus axonal loss. The distal end which is away from the cell body goes for Wallerian degeneration. Okay, the recovery is possible, but the recovery is very slow here. Okay, because it involves the connective tissue, that is, there is axonal damage. Okay, but the endoneurium is intact here. Okay, so it regenerates 1 to 3 mm per day. Can anybody tell me why only 1 to 3 mm per day? Why not 6 to 10 mm? That is there, but why not? It can regenerate more than beyond 3 mm. Because we want the nerve to regrow faster, right? So if it grows for 1 to 3 mm, then the recovery will be very slow. So instead of going for 1 to 3 mm regeneration per day, why not 6 to 10 mm? There is a physiological process behind it. Physiological reason behind it.